Welcome to Your Health is Wealth podcast. The podcast invites you to embrace the profound truth that your health is your wealth. I'm your host, Kristen Burke. This podcast aims to take you on a journey into the landscape of alternative medicine, integrative practices, and holistic healing options that empower you to thrive in mind, body, and spirit. Today in our segment titled Episode 9, Stuck in the System, How Our Healthcare Misses the Mark and the Collaborative Model That Could Make a Difference. I'm your host, Kristen Burke. Today, we're taking a closer look at the U.S. healthcare system, the challenges, shortcomings, and most importantly, the potential solutions that could pave the way to a meaningful change. I'm excited to be joined by three incredible guests, each with unique expertise as we explore everything from issues that we face in the current system to promise a more holistic, collaborative approach. We'll talk about how Western medicine, while essential, often falls short when it comes to treating the whole person. Our guests will bring perspectives ranging from emergency medicine, integrative oncology, functional medicine, and public health, offering valuable insights into what's working, what isn't, and how we can improve. If you've ever felt frustrated or uncertain with the current healthcare, or if you're someone who believes there's a better way forward, this episode is for you. Let's dive in and imagine what truly patient-centered collaborative system could look like. Please welcome our guest, Dr. Michael Girgis, an ER doctor, also serves as a medical rescuer for San Bernardino Sheriff's Office, and he also owns his own medical protection business. Next, we have Ariel Kazi, a nurse practitioner and integrative medicine specialist. She teaches at a nursing school in addition to those duties and owns her own business. Is also a provider on Connect for Healing. Lastly, we have Evan Toomey, a nurse, public health specialist, ozone and UVBI infusion specialist, and is finishing up her nurse practitioner's training this year. And she's also a provider on Connect for Healing. So I'd like to thank everybody for being here today.
Thank you.
Thanks for having us.
Absolutely. All right, so we're going to jump right into the questions. I'd like to hear from you, Dr. Girgis. What initially sparked your interest in healthcare, and how did it lead you to the path that you're on today?
So initially, I got into healthcare. It wasn't something I actually really wanted to get into. I wanted to get into law enforcement and aviation. And I had a back injury in high school playing football. And that kind of led to my inability to actually go into law enforcement at the time. And I think it was just over years of dealing with physicians, physical therapists in the medical industry that I started to just realize, oh, this is a profession that actually can help people. And started my college career that way and working with physicians with my own health. That's how it sparked my interest. And I became a pre-med major. And that's how I got through medical school and emergency medicine.
Thank you so much. Ariel.
Yeah. So when I was a young child, everyone dreams of being that firefighter or maybe a princess. And I decided I wanted to become a doctor. Probably like 4 years old, I was just bound and determined that's the path I was going to go down. And then by the time I was in high school, I had an opportunity to actually work in a hospital, in an emergency room, and saw them providing excellent patient care. The physicians themselves seemed so burnt out. They were overworked, overstressed, and there just wasn't enough time for them to get things done. So I was watching other people in the emergency room, and the nurses seemed to have it all. They had the time with the patients, they had time to work together as part of that team, but they also had time to enjoy their lives. And I think it offered some degree of balance. So I did go to school pre-med. So I finished all of that. And at the end of that, I was like, oh my gosh, I'm leaning towards nursing. And someone suggested at that point in time, maybe looking into becoming a nurse practitioner. So I went down the path of becoming an RN. And then a few years later, I became a nurse practitioner. And that's where I am today. And I honestly think it's such a wonderful profession. I wouldn't change it for anything else in the world.
That's the thing, is it's not necessarily a job or work. It's your passion project. So it's easy to integrate that and keep you going. We spend most of our hours away from home. And so if it's a passion of yours, it's going to make it that much easier.
It does. And it's something that you don't ever turn off either. It's just always there. It becomes a part of you. Even if there is a day where I'm not seeing patients, it's still there. It's still in the back of your mind.
Thank you. First of all, thank you for Dr. Kyrgios, what you do and your passion, and also Ariel. So, Evan, would you like to add to that?
Sure. So I had no interest in healthcare as a child until my brother was born in the 90s and was diagnosed with autism. And at that time, he was poorly supported in the medical and education system. And I saw my mom struggling with that a lot. So she had to look into alternative modalities to help her son. And watching that experience, I decided to go a completely different route and got into manufacturing. And I spent quite a bit of time in that industry. And I enjoyed the work that I did. There was a lot of quality control, a lot of geeky data stuff that I'm fascinated by. And unfortunately, my husband was involved in a traumatic accident. And through that experience, watching him navigate through the ICU and rehabilitation, I decided to shift careers and become a nurse. So that experience, seeing how coordinated the nurses, the physicians, the whole care team were to really come to aid and save my husband's life, and inspired me to transition into nursing. So I dropped my manufacturing career, went to school, and have really found a passion in helping people heal through root cause analysis, which I attained from my initial experience in the manufacturing industry. So instead of manufacturing parts of planes, I'm now working on parts of bodies, and it's very fulfilling.
Thank you for sharing that. And I'm sorry that your husband had to go through that. And it sounds like he's doing much better now.
He's made a miraculous recovery, and thank you. I appreciate it. He's doing great.
Absolutely. Through that experience, it shifted your focus on what you wanted to do for a living. It shifted you into an area where you saw you could make a difference. And also taking some of your background with manufacturing and quality assurance. And now, how can we get into the root issues of healthcare? And it sounds like that the experience also with your brother with the autism.
So, what I like to say about those formative experiences is, unlike some of my cohorts and my colleagues, I didn't know that this was where I would be. I didn't have a trajectory or a plan, but these experiences helped discover my passion, my path, and my calling. And now at this time, I can see how they benefit one another. And so there were times younger in life, and perhaps this could be inspiring for some of the younger listeners. You often feel overwhelmed by the ample amount of opportunity, but also limited experience. And so, what you're working on now can truly benefit who you will become later and the lives that you will touch, whether it's through manufacturing or healthcare. It has been a cumulative experience for sure.
And I think that when people get too far into a niche, it can cause them to miss the big picture. I'll use an analogy. Look at an athlete. Some of the better
Great
athletes
point.
are ones that actually compete in multiple types of sports because they're utilizing all of the different muscle groups. And it keeps some level of balance, I think. So the same would be with knowledge, the knowledge and the application.
Excellent point.
As healthcare professionals, each of you work in very different aspects of medicine. How do you see the challenges of the current system playing out in your specific areas of practice? Ariel?
Yeah. So I would say that I believe that in my specific area, so focusing a little bit more on like the integrative side, that the challenges that I see are that in terms of correcting patients' healthcare, that there's simply not enough time. So let me go into that. So, in regards to time, in a traditional model, and what we're seeing right now in healthcare as a trend is seeing that reimbursement rates for providers is being cut back, meaning either it's not keeping up with inflation, or the amount of time or the amount of patients that they're going to need to see in order for them to stay in business is going to be a large amount, right? So they simply don't have the time to spend with them. And it's such a disservice because that's what you need in order to figure out exactly what's going on with the individual. That's what you need in order to problem solve. And I think that it becomes a very complex issue where the time aspect really weighs heavy on the provider. But if we flip it to the other side, patients are paying a large amount of money to see their providers, whether it's through their premiums for their insurance, whether it's cash pay, and if they're not respected and provided with that time, then they feel shorthanded and they feel like their concerns aren't being addressed. And so it tends to escalate where there's frustrations on both sides. Some of it's misdirected, right? It's just a frustration overall with this health system that we're in right now. But then it's in the mix of everything that's happening. So the patient's sad that they don't get the time, the provider's sad that they feel rushed, right? And then who stands to benefit? Not neither of them. Only someone else who probably doesn't even work in an office. They don't even see any of these patients. They don't even see the people who it's affecting. And so I see that as a really big challenge right now and a concern across the board. In integrative medicine, I feel like there is a little bit more time. It does slow things down. We do have the opportunity to sit and talk about what's actually happening. And that's the benefit of being able to see somebody who has that ability, because we can really get towards the bottom of what's going on with the individual. We can really work towards the multifactorial aspects of it because it's not just one thing that got us there, right? It's a multitude of things. And I've been in healthcare for probably about 20 years now. And I would say that I'm actually starting to see trends that are getting better. Patients are doing their own research before they're coming in to see the doctor. It's not all WebMD saying that you're having a stroke or it's cancer or something outrageous or outlandish. They're actually diving in and they're learning more. And then similarly, too, I also see providers, right? Things that they weren't taught in school that they're actually figuring out on their own. They're doing their own independent research. They're seeking out alternative means to figure out why they're seeing that trend or how to explain this differently to patients or what's a different treatment methodology rather than just prescribing a pill. So there's challenges, but I think there's also really beneficial changes that are just on the horizon. They're right there. And maybe we're not like the wacky providers everybody thought that we were, thinking that this is the way to make people healthy, right? Maybe there's a smidgen bit of truth in terms of what we were preaching out there for a while.
Thank you. And just to your point, it's frustrating for both sides, the providers and the clients' patients. So it's not really necessarily the providers, it's the system and the system they're working within with the limitations, and they're guided to a workflow. If this, then that, and sometimes they're limited to that workflow. But addressing the time limitations, when you're trying to meet with a patient or client that has a chronic illness, I had fibromyalgia for 25 years and I didn't feel heard. And part of the therapy process is to be heard. And I'm putting blame on the provider, but if people are feeling like they're coming in 10, 15 minutes, there's just not enough time for that interaction, that empathy. It feels almost sterile, at least as a patient, and you do have to advocate for yourselves. And I'm lucky enough where I have a provider who is very open. She doesn't agree with alternative medicine necessarily, like naturopathy or Ayurveda, but if there's something that I want outside of the box, she's willing to make it work. And so that's a provider kind of pushing back towards the system too, which I think is fantastic. When you mentioned that there are a lot of doctors and or nurse practitioners, providers in general, that tend to do their own research, is there a particular age group that you notice this? Is it more of the newer folks coming in, maybe in their 30s, 40s versus their 50s or 60s? Have you noticed that?
I would say that I could broadly generalize and say that those who have been well established within the community, right? So you're suggesting like 50s or 60s may be less likely to do that. I wouldn't say that's always the case. In fact, just speaking with one of my provider friends the other day, and she's well into integrative medicine. That's basically her second career, and she's 78, but she does all of her own research constantly every day. So I wouldn't necessarily categorize it broadly. I would say that there is probably more of an openness towards different modalities and encouragement to do your own research, probably with newer graduates. It isn't quite so ingrained that this is the only way to do it. There is a little bit more flexibility in the newer generation. And I can't per se say whether that's the education that's changing or whether that's the temperament that's changing. But it definitely is a different type of approach. And I would say that probably, yeah, late 20s to 30s, depending on their specialty when they get out of med school, are probably a little bit more open to a variety of ideas and doing their own independent research. But I wouldn't say that the older generations wouldn't do that, but it may not have been taught or encouraged or influenced in the same way. So,
Thank you for that. Dr. Girgis?
Yeah, to answer your question, being in an emergency medicine is a little different. Starting 20 years ago, emergency departments have always been busy. I've just seen it progressively get just more and more busy, where maybe there was a few hour wait times 20 plus years ago. Now, sometimes during the winter months, you can get 6, 7, 8, 9 hour wait times in the emergency department. And one of it is not really even population based. It's not like we've grown in population. It's just basically been the downfall of primary care. And part of it is not enough primary cares. The kind of time constraints on primary care now have forced a lot of physicians to make ends meet. They want to go into now specialties and subspecialties because that's where the money is now in the industry. And they don't want to get stuck into a system of primary care where it's, you got to see 4 patients an hour to make ends meet to pay off $400,000, $500,000 worth of undergrad medical school bills. It just makes monetary sense for them to get into these subspecialties, which basically means there's no primary care. And now when someone who's got the UTI, the flu, the cough, the cold, maybe sprained their wrist, needed a quick x-ray that could be seen in primary care, they're no longer available. They've basically saturated the urgent care kind of time slots. And then basically everything goes to the emergency room, where physicians are with something that could be very simple or something that could be very complex. And sometimes you have to cut time out on the very complex, and you can't spend as much time with them trying to figure out what's going on for all these other patients that have minor, problems, injuries, but it's still very time consuming. And it's really hard to deal with a complex situation and then be 4 other things going on with maybe something that's not as complex, but it does take your time from you. And it's hard because, I mean, there's been things where I've missed that maybe a nurse has caught later. Oh, did you hear about this? From the patient was telling me about this and this, and I've completely missed it. And it completely made a 180-degree difference in what I did for that patient in the emergency department. So I think that's one of the big things. And I think just medicine in general, we've gone away from health in terms of just our diets, in terms of our activity. And what happens is Western medicine has become have a problem and treat it with a medication. And fine, doctors can talk about, oh, you need to eat healthy. You have to do this. You have to do that. But they say it and then the pills. So until we figure out our food system, our fast food system, our addiction to sugars, our addiction to sweets, just the general poisoning of our even agriculture with pesticides and things like that, our water supply, until we get a handle of all that, you're just going to have a nation of very sick people. When this country is the only country to allow like red food dyes, while other countries are a lot healthier than us, and we still allow it. And it's basically just recently been pulled off the market by the FDA a week ago, while other countries have had it off the market for tens of years. There's a problem. There's a problem with our system, and who's running our system. Is it for the health of our people, or is it for the health of kind of capitalism and these big pharmaceutical and food corporations? So I think there's a lot of physicians probably that think and feel the same way. We're just caught in a system where it's corporations have basically taken over the food and drug industry, and now they've taken over the medical industry, and it's become corporatized. And now you're no longer a physician who can do what they need to do to keep their business open. You've basically been sucked up by big corporations, and you're told now you've got 15 minutes per patient, and this is what you have to do, and you have to have this many percent vaccinated, or you don't get money, or you don't get paid, or you don't get reimbursed. And that's just the way the system is now. So just a lot of things have to change if we're going to actually fix this health system that we have.
Wow, a couple of follow-up questions. So you were mentioning that in the ER, you've seen an increase in influx of patients going in there. I think you said it's not necessarily due to the population, but because there's been a decrease in primary care providers going into specialties, now they can't get into their doctor. And so the only way that they can get any form of care is to go to the ER. Is that an accurate?
Yeah, pretty much. When you call for your primary care to make an appointment for something that you need within the next few days, and the next appointment is 3 months out, what are you going to do? You're either going to one, not get care. You're going to go to the urgent care. And if they're completely busy and they have no time slots, you go to the emergency department where we can never turn you away. With Entala now, anybody can come in for anything and not be turned away. You may have to sit for 8, 9 hours, but you will get seen sooner or later. And now with kind of corporate medicine, there's numbers, there's stats on wait times to get seen by a provider. And a lot of times they'll actually keep sicker patients outside so they can move the quick patients through so that their wait time numbers are not affected. It happens all the time, all over the place. And that's just the way it is. If you put someone who's sick, and when I say sick, I'm talking about is not dying out in the waiting room, but is in pain or is going to need an extended treatment plan or may need to be admitted. And now it's going to take up a bed for 6, 7, 8 hours until they can be moved into an inpatient bed. Sometimes those beds can turn 15, 20 different small injuries or minor complaints that can be turned over quickly to just clear out the waiting room. And I see it every day. And a lot of doctors will push back and a lot of administrators will say, oh, we don't do that. But it's very obvious that you do that. When an 80-year-old with chest pain is sitting outside while a thumb injury comes in, that's an issue. But like I said, we have to fix the healthcare system where thumb injuries don't come to the emergency department. If they just need a simple x-ray and a simple splint that could be done in an urgent care or in a primary care office, that's basically what we need to do.
So gotta take a breath here for a second. So you're saying that if the triage process is not determined based on the illness, the severity of the illness necessarily, unless they look like they're possibly dying, then they're going to be triaged in. But if you have someone in extreme pain who has chest pains, they may be sitting in the hall longer than the person that needs the splint.
It happens. It happens all the time. We have a triage system. Obviously, the whole point of a triage system is to find out who's the least acute to the most acute. And in a triage system, you should take the most acute and bring them back and start workups. Sometimes you've got people in that middle where maybe someone with a thumb injury has been waiting 8 hours and someone with chest pain has been waiting 2 hours. Sometimes that thumb injury waiting for 8 hours is going to go first just based on they've been waiting longer. But in the reality is in the emergency department, emergent things should go first, is my opinion. And I think a lot of our docs' opinion is the 80-year-old with chest pain should always, I don't care how long you've waited for your thumb injury. Person with the chest pain who shows up to the emergency department should go first. But a lot of people don't see it that way. And a lot of administrators don't see it that way. And until you actually are able to take that thumb injury and say, hey, listen, we have a time slot for you in urgent care, or you can go to this primary care doctor, or you can do this and please do that. It'll be a lot quicker than you're going to get seen here. This is just going to continue to happen.
My mind is blown. I didn't know this.
It happens on a daily basis.
Wow. Okay. Going back to some of your comments on, it seems with the healthcare system, it's degraded a little bit. You provided some nuggets here, so I'm going to follow up on them. More towards putting a Band-Aid on a bullet hole. Those are my words, with medication versus identifying the root issue. In addition to an increase in influx in the ER department, because maybe there's a decrease in primary care, there seems to be a different approach to healthcare altogether. With medications, and it's interesting because if you look at some of the stats with chronic illness, those have increased at really high percentages over the last 20 years. And I'll provide some of these links to stats in the podcast at the end and all the social media posts. But for example, just looking at autoimmune in general, it affects 5 to 8% of the population in it, which translates to 24 to 48 million people. And this is NIH data. But there's been an increase in prevalence. And so we're now seeing trends with women are disproportionately affected by autoimmune, with approximately 80% of patients being women. And it could be linked to hormonal differences, environmental factors. There's a whole host of things. Fibromyalgia, same thing, huge increase. Gut health issues, to your point. Food, environmental factors, weather stuff that people are talking about with the weather. What is it? The airplanes flying around, changing the weather, which can decrease your access to vitamin D, right, through the sun. Other, just lots of different things going on. Do you think that it's more likely our food and environmental factors that are causing the issues? Or do you think there's a possibility that the increase in mental health issues could be also exacerbating that?
That mental health issues can be exacerbating what?
The other chronic illnesses that push them to go to the ER doctor, like autoimmune issues, pain.
I don't know. I think mental health issues, I think a lot of mental issues are either from drug abuse or could be people self-medicating with drugs and worsening that. I'm not a psychiatrist whatsoever, but can mental health issues be related to our food source and our chemical exposures and environment? I don't see why not. I don't know 100% for sure. Is the research out there? I don't know. We just look at our health system and what we spend on our health system. And you look at some of these other countries that have cleaner water, cleaner food supply, who have banned pesticides and toxic dyes and things like that in their food supply. And they're a lot healthier and they're less obese and they're not stuck on medications like we are. I see patients all the time. I could spend 5 minutes reviewing their medication. They're on so many medications. And who knows the interactions between all these medications? There's no clear science. Nobody's ever studied on if you on these 5 medications, what does it do to your body? But every subspecialist is treating some chronic illness with some medication, and this subspecialist is, and then they go in for this infection and they get antibiotics, and who knows the havoc that all these different medications are doing. But this is a system that we're stuck in where it's basically really hard to figure out what the root cause is for this disease process. And we just put Band-Aids on it with medications.
Agreed. And there's been a huge increase. And to your point, and I do have some of the data, the drug trends, prescribed medications, not just with doctors or nurse practitioners, but also psychiatrists. Some of the drugs that were intended to be used, for example, for epilepsy are now being used for pain. I'll just throw it out there, pregabalin, gabapentin, which can be very dangerous actually and have a high potential for abuse. And there are some studies out there that do show drug interaction and how it could impact digestive properties too. You know what's interesting? I'm going to go to you, Evan, is we spend quite a bit of time on quality assurance of products that we make in the US. Root cause analysis. And anyone out there who's a quality assurance manager, root cause analysis, you're getting down into the weeds, right? What is really causing this? But we're not doing that with our health. Like I don't think we're doing that at all. And it's really surprising to me because your health is your wealth, right? If you're dying, all of these things around you aren't going to matter over time. So I wonder if you feel comfortable talking on that topic at all.
I do. So I think one thing to recognize is when we feel good and we tend to not pay attention to the issues until there's a annoying alarm bell or you're very sick and now you're forced to deal with the situation. And so I think that's where we have it wrong as a system, as a healthcare system. So looking at it through the scope of public health, we fail greatly at the primary prevention level. So we like to look at things, how can we prevent? How can we screen? And now how can we treat? And we spend a lot of our time in treatment. And we do a fair amount of screening. Of course, that's dictated by our payers, which is often the insurance companies. What will I say you're eligible to be screened for based on your age, your ethnicity, and your gender? So we're not getting to screen as early as we could, which is an issue. But just to speak to some of what we've heard so far and the acuity of the patients that we're seeing in the hospital and in primary care, a lot of it is they're to a point that their illness or dis-ease in their body has grown so quickly. And so we're trying to address it at a part where it's already advanced. And to say that in another way, we're often introducing to them that the diet, their mental health, their spirituality, their external environments are influencing their health, and that's news to them. And so it's almost like shaming. I see this a lot in primary care where I ask, so what are you eating? And often they almost feel attacked by me suggesting that the foods that they're eating are greatly impacting their health, negatively impacting their health. And so, again, to say that this is a failure at a primary prevention public health level, because we're teaching everybody use the mind plate and have a well-rounded meal and not really knowing the ingredients. And I love that we have the internet. So patients are starting to get information and come to us and say, hey, I heard about this. I saw a podcast. I read on Google. And wow, those aren't always quality answers, but it's a really good thought-provoking thing for these patients to come to their providers and get better guidance with. And I think that's where we need to shift, because then it will reduce the burden on the hospitals and allow patients to step into their health, understanding that it starts early. It starts with what you're drinking, what you're eating, and what you're doing. And then those things, of course, are going to affect things like your microbiome and how that affects your mental health. And so what we are so divided as far as our system goes, that primary cares aren't in that cahoots, and we need to be, because the human population is massive. It's a great undertaking to try to design a system that's going to take care of all the people we have in the United States. That's huge. And so, of course, you're going to have some differences there. But I think just going into root cause and hitting that pause button for a moment and saying, okay, how can we not add a pill? How can we not just give you ER precautions on your 15-minute primary care visit? How can I educate you as in childhood, right? In adolescence, in 20s, so that we're not getting this massive burden of autoimmune disorders and cancers and stuff later in life. That's really costing us billions of dollars across the nation. So there's my answer.
Love it. Thank you. So it seems like we've moved away from simple, basic foundational needs: food, sleep, daily routine, spirituality, being connected with self, all these basic things that keep us going and stable. And we've complicated things. It's like Simon Says, right? 2 steps to the left. Now, oh, guess what? We got to go this way now. And we saw that with COVID. Every time we turned around, everything changed. And that's been our healthcare system. Don't drink milk, eat meat, don't eat. I remember when they were pushing margarine, which is one of the worst things on the market. That stuff's not going to break down very easily. But if you look at some other forms of medicine, some of the oldest forms like Ayurveda, Chinese medicine, they've never changed. Their practices have been the same since the beginning of time. But Western medicine changes all of these things based on studies. But you got to wonder, why? What's the variable here? Going back also to the patients and clients feeling shamed because they're asked these basic fundamental questions, like they're feeling like, oh my gosh, I'm responsible for my health. Yes, you are. You get to choose. You get to choose which path you're going down. But that is not how we were raised in the system, at least for me, that I remember. It was looking at the doctor as not necessarily God, but someone that just knew so much. And as things have changed over the years, things have become more complicated as to why we're sick. It's like all these millions of reasons, and it's confusing.
I'm wondering if you feel that we've moved away from the simplicity, if that's part of the problem, and made things more complicated. Ariel, do you want to take that?
Yeah, actually, I would say that is probably at the heart of all of this. We don't know how to grow food anymore. We don't know how to prepare food anymore. Everything comes to us in the frozen food section or on a shelf, right? We're not used to actually going to produce, right? If you've noticed over time, I feel like produce departments have gotten smaller and smaller because people aren't buying the fresh foods as much as they used to, right? And the rest of the grocery store is just filled with prepackaged, pre-made items that are loaded with salt, loaded with sugar, loaded with all of these things that we know are so harmful because it's cheap to produce, right? And so there's the argument there that is affordability versus health. And it really shouldn't be that type of a question, right? If you look at all of those other societies where we're suggesting that they're healthier because they don't have dyes in their food, they go to the store every couple of days. They don't go once a week and stock up, right? They're going every day or every other day to get fresh new food to prepare for their families. And it's not like they're there for hours, they're there for 10, 15 minutes. They get what they need for the day or the next day, and they go home. The food is organic. The food biodegrades. You shouldn't have produce that sits on your countertop for weeks on end without breaking down. That's not normal. That's not right. We need to learn to go back to the basics. Ironically, and I just find this as like an interesting little tidbit, is that Walt Disney built Tomorrowland in California to have everything is edible, technically. All the plants in Tomorrowland is edible because his thought process was he saw all these changes happening and he believed that eventually we were going to go back to being farmers again because we were going to get tired of the trends that he was seeing, even at that time, and go back to basics. And honestly, I think he's right. We should get back to that, having everything. If you want to have farmers and go to the store, I think that's wonderful because we all need to have our professions, right? We all need to be able to have that diversity. But at the same time, you should still know the basics. You should still know how to take care of yourself. And the root of that, food is medicine. Food is always your first line therapy. It should never be a pill. It should always be food first. And then everything else follows suit, right? So there's an aspect to the spirituality and the mental health of an individual. It starts at how you treat your body and what you do to your body every single day. Are you giving it water? Are you giving it good food? Are you talking positively to yourself and about yourself to others? Right. So these are all the basics of what we should be doing every single day. And we are fed not just food, but social media and several other platforms, filth every day. So it all contributes. It's all part of it. But absolutely, food is something we need such focus on. Most of our food shouldn't be corn and wheat. I'm sorry, it just shouldn't. It should be things that provide the diversity of micronutrients that our bodies absolutely need and crave every single day. Even if we look at how foods cause certain cravings, it's usually to correct certain imbalances, even things like pica that we can see in sometimes pregnant patients where they might crave eating dirt or chewing on things like chalk that they shouldn't be chewing on, right? It's usually a lack of mineral deficiency, or it's a mineral deficiency that they're incurring at that time. So your body tries. Your body desperately tries. Sometimes craving chocolate, you're actually hungry for magnesium, right? Sometimes you're craving the micronutrients that your body knows is in there. So our bodies are pretty smart. We just have distanced ourselves from that knowledge, and it's a problem. It's a real problem.
I 100% agree with you. Your bodies will always tell you when something is off if you tune into it. But when you have all these distractions, especially some of the pharmaceutical drugs, I'll say it, toxicologists, that can detach mind from body. If you can't feel it, how do you heal it? To a point. But your body, if you're in pain, it's telling you, quit doing X, right? Do this instead. Oh, I'm tired. Did you sleep? My stomach hurts. What did you eat? What time did you eat? What did you pair your food with? And I have to say, you sound like an Ayurvedic practitioner. With the food is medicine and fresh food is so important. We call fresh food prana, which is life force. And as the food ages, the prana decreases in the food. So you're not getting the same level of nutrients. And when we have chemicals in food, which usually show up in packaged foods, frozen foods to your point, and canned foods because they're extending the shelf life, those very chemicals can actually deter your ability to absorb nutrients efficiently. It can do that. Very similar to the mechanism of pharmaceutical drugs. Some of the chemicals are very similar. So what you talked about is our bodies can feel that, or your bodies have the potential of healing themselves if you allow them to. But that's consciousness, right? Being able to be connected in tune. That's the spiritual aspect that Evan was talking about. So food is a form of energy. Water is another form of energy. Being outside from the sunlight is another form of energy, from outside in the fresh air. It's also important. And then going back to growing your own food, or people getting back into farming, you're taking in all of those elements, as long as it's obviously an organic farm where it's not being affected by some of the other stuff in the air, is, I think, something we really need to look back to, going back to. And I know there's folks that aren't necessarily fans of that, right? Example, when I hear, what is it, a plant-based, the very first thing that pops into my mind is processed foods, because there's a lot of processed foods that are marketed with plant-based on it, which, if it's truly just a plant, right, a whole plant, wouldn't you call it fruits and vegetables, maybe the plant? But I get nervous when I hear that term, because I see more and more that, like the fake meat, which, if I went through how that stuff is made, a lot of people probably would never buy it again. With the side products that are byproducts that are made off of that. That could be another whole episode. But anyway, thank you for sharing that. And I think that's especially coming from all of you in the medical industry, that even though you're working predominantly in Western medicine, but you're also very open and integrating other aspects to help people heal. So let's move on to the next topic. I want to start with you, Dr. Girgis. If you had a chance to sit down with lawmakers, what would be the top changes you would advocate for in order to improve healthcare?
I think it's going to be prevention of disease, right? So education, our food supply, the way our food supply is covered in pesticides for numbers, the way our animal and feed supply is given hormones for greater productivity, antibiotics for greater productivity, just the way our city streets are lined with fast food and things like that. And some fast food is a lot healthier than other fast food. Looking into that, you look at the soda industry, there's just so much. And then I think the other thing is just primary care and increasing the ability. And they've been trying forever to try to increase primary care physicians. Until you change the model of how primary physicians get compensated, medical school costs, it just doesn't seem like primary care is going to ever grow when medical school prices are just getting way out of hand, and primary care salaries are stagnant. So I think those would probably be the biggest two. It's what we put in our bodies, and then also just that general checkup. But the reality is that I think everybody has to take their own health into their own hands. Nobody's going to make them healthy. Just going to the doctor once a year to check your lipid profile and your thyroid hormone level and your PSA, it doesn't make you a healthy person. It's what you're doing on a day-to-day basis. So I think everybody has to, once they realize that basically their health is, part of it is genetics, but a lot of it is not genetics, right? Unless you're born with type 1 diabetes. And I can get into a whole thing about it, just all the autoimmune disease and just its influx, autism rates. And it's just, it's crazy, just multiplication over the last even just 20 years. Like, it's insane. When is anybody going to ever really question why 1 in 30 some odd males, per CDC is going to have autism in the next year or so? I mean, it's insane when you look at just the trends that are reported on CDC website. It's like, this is insane. Is anybody going to ask why? Is anybody going to investigate why or how? It's not a genetic based disease. There shouldn't be any increase like that. I don't know. It's optimistic, but I'm really not that optimistic in the way our system is going, just because I think it's just run by corporations. And I think you're going to start to see a large group of people who are just going to say, nope, I'm done with Western medicine. I want to see a holistic physician. I'm going to change the way I eat, the way I drink, what I eat and what I drink, and where I get my foods from. And I think those are going to be the most successful in making themselves healthier.
I completely agree. And I often use this quote. It's a Dr. Phil quote. And to any congressperson out there or anybody's, trying to push things status quo, I'd say, how's it working for you so far? Or how's it working for us so far? If you just look at the stats, it's just getting worse. Continuing on this path is literally insanity. You said that. Isn't that the definition of insanity? Not making any changes and continuing on that same path. And then, but what seems to happen is deflection and or distraction. The root issue isn't being looked at. Just to your point, is that, and the education is going to be huge. Education for clients and patients, because they are being put in the position where they have to advocate for themselves more than ever. And let's just say, for example, a Western medicine doctor wants to look at alternative therapies. Many times they don't know where to go. A patient may come to them and say, I would like to check out Ayurveda, for example, or I would like to try out naturopathy or this herb. And the Western medicine doctor or providers may say, I don't know anything about that. We're not taught that in medical school until you do your own research, which you may not have the time to do that, right? Especially when you have a whole host now of patients who are watching this stuff on podcast and starting to get educated. How do you address that? How do you address that influx of them asking for that help, but you don't necessarily know where to find that provider? Evan, do you want to address this one?
Oh, yeah, this is a fun one for me. And I'm passionate about it. And I just want to rewind for a moment because I've learned this from kids. I love kids and I have some. I've also learned it from my kids, the but why. So, speaking about education, in nursing school, in the advanced practice program, in pharmacology, we're taught, okay, your patient has this sign and symptoms. We're going to do this workup. They get this diagnosis. Now we give them this med, right? It's just, that's how we do things. And I like to say, but why? So the pathology, right? What went wrong? Can we fix it there? But then I also go, but why that medication and what's in it? And because I'm just a geek, I often will research what's the ingredients of this medication. Okay, what does this medication do? Is it a synthetic? So many times I have found in my research, and I encourage you to go out and do this same thing. And like PubMed, there's a lot of resources you can use, but often drugs are made to mimic what a plant does, what a herb does. So very often. So to me, but why not use that? Now, there's a caveat. Again, we're talking about people who have high acuity. They're sick. We don't really have time to use something that's going to take a slow, right? Because this disease grows. And so there are times where fast acting med to keep them safe while they adopt these things are important, right? That's why we need to integrate the two. In school, we're taught, oh yeah, don't use ginkgo biloba. That's going to cause all these potential interactions with the med. But why? The reason is you're going to overdose because they do the same thing, right? As we have access to information, providers can start to network and learn from each other that it's okay. Ask why. It's okay to dig deeper and to think maybe there is an alternative. And just to actually answer the question that I think you asked, we're so lucky to have growing bodies directories so patients can find educated, holistic, integrative practitioners. Like the Connect for Healing platform is amazing because you can search out someone who has the knowledge for what you're dealing with. And the practitioners can talk, and it's a really good, safe space for us to really get into the root cause and deliver the type of care that we want to do, and we know how to do, and that we know what works, instead of following this. You come in, I weld on a diagnosis on your back, and that's your problem for the rest of your life, and here's your drug. That's really not the approach. And by having other uh, basically networks that providers can be in and patients can search is going to be monumental in shifting how we do healthcare in the US.
Thank you. Going back to the herb, or many pharmaceuticals will behave the same way as an herb. They're taken from a whole plant. Example, the valerian. We take a section of that and we add chemicals to it to create valproic acid, which is Depakote. That's targeted for someone who's going through epilepsy, right? Seizures, anti-seizure medication. It's very strong too. But valerian is it because it's a whole plant. The way that plant would be different with an herb is many times we'll put herbs together. You're not just targeting one area of the body, you're targeting the entire body all at once because we know the systems go together. Example, high blood pressure. Many times we see people with high blood pressure, they're given a high blood pressure medication, but we don't necessarily know why they have the high blood pressure. We know the renal system's connected to the heart. Many times they might have inflammation in the bladder or urinary tract, the kidneys, which can actually affect the blood pressure in the person. I'm not saying that they wouldn't necessarily need to take that medication, but maybe they didn't need to if we look farther into what's actually causing the issue. What's going on with their gut health? We know there's the brain-gut axis. I think one of you guys mentioned that earlier. And that absolutely can have an impact on mental health because of that access. So it's really interesting. To your point, Western medicine absolutely stabilize diagnostic tests. What's going on with this person? We need to react quick. That's where Western medicine is so strong because they're to save lives, prevent death, right? Stabilize that person. Then maybe we have a psychotherapist to deal with any trauma, which we know can be one of the predominant root issues of illness, chronic illness in a person. They support the mind. And then we have alternative medicine, such as Ayurveda, naturopathy, Chinese medicine, homeopathy, are doing the root issue kind of investigation, working with a team of people that all learn from each other. And with the collaborative type of model like that, not only are patients or clients getting support, but the providers can bounce stuff off of each other. It's essentially free education and expanding your knowledge into other areas, and then actually being exposed to these other modalities firsthand and knowing who might be a good quality provider, right? Because we know that just because someone has licensure, someone has a credential, doesn't mean necessarily they're the good fit for everybody. But Ariel, your background in functional and integrative medicine brings a unique approach to patient care. We were just talking about that, kind of a more patient-centered care. How does the model differ from a traditional Western medicine approach, particularly in managing chronic illnesses or autoimmune?
Yeah, so this is a great pivot point and a chance to talk a little more to what Evan was saying about integrative medicine, which is it is the pairing of essentially contemporary or Western medicine with other modalities. So whether it be supplementation, homeopathy, it could even bring in Ayurvedic practices. While they may not be certified Ayurvedic practitioners, they may be bringing in some of the principles into how they practice medicine and how they look towards addressing root cause. So at the end of the day, it really is a high focus on both sides of either looking at a problem to address holistically is one, and then two, which modalities are we going to choose and what's going to work best with you. So it's a model that's very flexible in terms of managing the patient. So let me explain how it can be so flexible. Most of the time, an integrated practitioner, it has some degree of Western medicine teachings or licensure or degree. And so they can pair that together with some of the other information that they've built or some of the other knowledge that they've gained. So it could say the patient was diagnosed with diabetes, as a great example, type 2 diabetes, and we can stabilize them with medication or we can get the ball rolling with medication. But at the same time, we would still work with them on diet and lifestyle modification factors. We would spend more time talking to them about how do I address this specific issue? Maybe pairing supplements as well, if necessary. So I've definitely had my fair share of patients who have come in and they've been diagnosed hemoglobin A1Cs of 13 plus. They don't want meds. Okay. You get 3 months. And why 3 months? It takes time for your hemoglobin A1C and a lot of the other measures that we're looking into towards whether this is actually fixing itself or this is a isolated temporary event, right? And so you get 3 months. We can work on diet, lifestyle modifications. We can do the supplements. And if we're not seeing significant changes, we have to do the meds because, like you guys said, I have to save your life, right? I have to do what I have to do to protect you from these long-term consequences. I don't know how long you've been 13 for. That's a really high number. Your blood sugars are like 800s, 600. They're excessively high for a long period of time, right? But with that patient specifically, 3 months later, I believe their A1C was down to a 9. And then another 3 months later, because we were seeing significant process, it was down to a 6.5, which is basically pre-diabetes. It's no longer considered diabetic anymore. And they continued on that trajectory. So it's all possible. And I think that's the beauty of integrative medicine is we can take both sides. I can say, yes, I need to treat this today because your blood pressure is 210 over 110. That's a bad thing, right? I have to correct it now. But I also can work with you on addressing what's going on the underlying side. We can work on the multitude of factors that's causing that. So if we're looking at an autoimmune condition, many autoimmune conditions have a gut or dietary aspect to them. And that's usually part of why we started to see some of these issues. The chronic inflammation, the chronic pain tends to come from chronic digestive concerns. And that could have started from one of two things. You mentioned before the gut brain axis, and that is because there's a direct link, nerves that go from the gut directly to the brain. And that's because there's such a huge correlation between the two. In fact, most of your neurotransmitters actually sit in your gut, not in your central nervous system. They're created in your gut, and then they're used by the central nervous system in order to communicate, right? So there's a reason they have to be so directly connected and correlated with each other. And with that said, there's so much of our diets that communicate the problem that's happening to the brain, right? So that sensation of pain, that sensation of depression, that sensation of anxiety is probably coming from the gut, right? I'm not saying all cases of that do come from the gut, but there's a big correlation there. The other side being that there was like an offending agent, a trauma or something that caused that unrest to begin with. If we were looking at it from a scientific perspective, the neurotransmitters to go out of balance. And then that is going to cause the gut issue, right? So they're all connected. It's all interweaved together. So at the core of everything that I would use to treat in a functional or integrative medicine practice, I tend to focus on 3 key areas. I've heard them used in different ways, but basically spiritual, mental health, and physical. And a lot of the physical is diet and how your gut is doing. I'm really big on gut health in case you haven't guessed. On the mental health side, some of that corrects itself, but also there's mental health practitioners. And I cannot say enough for how much they help the holistic part of taking care of an individual. And then lastly, spiritual. And it doesn't have to be religious. I'm not necessarily talking about a religious aspect. I'm talking about there is something else to us, whether you want to call it an energy, whether you want to call it a spirit, whether you call it an ether, right? It doesn't matter. There's something else to us than our physical bodies. And I would say most people probably believe in that. And that can be in unrest too. And so making sure we're addressing all key aspects of that person is what makes it integrative, right? Everything comes together like this. So that's what I do.
Beautifully said. And 3 things that are important to me are health, safety, and freedom. And I would say that maybe this is a blessing with patients and clients being more involved in their own health and making those decisions because that's empowerment. That creates that freedom to make those choices. And that will also incentivize them to stay on path when someone comes in with other types of modalities, as suggested modalities outside of Western medicine, for example, like yoga, meditation, taking a walk, and changing when they're eating and the food that they're eating in their diet. Speaking of freedom, I want to go back to Dr. Girgis. You made a comment earlier about, I think maybe it's a healthcare system or specifically to doctors, correct me if I'm wrong, but that you were incentivized or maybe incentivized to certain prescription drugs and or vaccination for clients and patients. If I've mischaracterized this, please correct me.
Yeah, no, I've never been incentivized, but I've heard primary care, like pediatricians being incentivized to make sure that 70% or 80% of their panel are vaccinated. Otherwise, they lose out on a tiered kind of bonus system. And this is what I've seen, what I've heard of. I don't know if it's every HMO or every insurance company. I've never had an incentive. We were incentivized for years with the whole opiate crisis, and prior to being an opiate crisis was the whole pain scale.
Right.
And there's still monetary incentive, but it was a patient satisfaction, 0 out of 10 pain scale, never allow anybody to go home with like more pain than 3 out of 10, no matter what it was. And there was a time where they were pushing Norco and things like that and other pain medications for these patients to just try to improve patient satisfaction via the pain score, making sure nobody was in pain. And they did it. There was a time where they gave us a Norco stamp of 30 tablets. And I'm like, why do I need a stamp? Is there any stamp for anything else? Here's a healthy eating stamp, or why do I have a Norco stamp? And I questioned it and I laughed and I'm just like, it's a clown show. Like, we know this is something addictive. But Norco's least addictive. Now all the MS Cotton and the other medications that there's now documentaries on Netflix and multi-billion-dollar criminal assessments against some of these pharmaceutical companies. Well, what they knowingly did, which is basically just get people addicted on opiates. So yeah, you always have to question things. I like Evan's why, ask why, and you can never really get a great answer most of the time. And now that we're looking back, I mean, that whole pain scale was invented by the pharmaceutical companies to, basically push their medication. So always got to ask why.
I love that. Always gotta ask why. That's getting to the root of it. And yes, we saw the opiate crisis. And as a forensic toxicologist, we saw an uptick in those drugs in many of our impaired driving cases. Of course, now there's a fentanyl crisis going on now. In regards to prescription drugs, do you feel that, and I know you're in the emergency room, so this is different than being in a regular primary care's office or a specialist's office that are prescribing many medications to people that can actually affect them cognitively. Do you feel that physicians have a clear understanding of what these drugs can do to them and how it can impact their ability to drive and also function at work?
I think I do. I know that just even taking Benadryl is going to affect your ability to drive. People take Benadryl all the time for their hives and for their whatever. People take Benadryl to even sleep. That's basically the component in Tylenol PM that helps you sleep at night that everybody's taking. And I laugh. I go, why are you taking Tylenol PM? Just take Benadryl already. Why are you taking Tylenol, a medication that you don't need to take because it helps you sleep, and paying 10 times more than just taking a generic Benadryl? So people just aren't educated. But what are you going to do? It's not my role to tell you that when you take this medication, you can no longer work. I'll tell you that it's going to make you drowsy. You need to take it accordingly. You may want to take it right before you go to bed. Probably not the first thing you want to do in the morning. But I mean, we have to have some common sense here. If I tell you it's going to make you drowsy and you shouldn't drive on it, and the pharmacist tells you it's going to make you drowsy and you shouldn't drive on it, and you go drive on it, that makes you the idiot. That doesn't make me the idiot. So we have to, yeah, we have to own our own medical health. We own our own health. You have to take ownership of it. And if you want to blame other people, that just tells me more about the person themselves than their condition. So
I totally agree with you. I think everyone's responsible for knowing the impact of medication. But I do know personally, I have interviewed many doctors that don't necessarily understand how all of these prescription medications affect every aspect of the body and drug interaction. Do you have a look at all of that?
Right. Yeah. When you say that, then there's not one person in this world that knows every single drug interaction. And if there is someone that knows that, then I'm going to call them a liar in their face, because you don't know when you're taking these 13 different medications, what are the drug interactions versus taking maybe 6 of them, or what are the drug interactions if you take them at this time versus that time. Now you're just lying to yourself. We don't know. And I don't know if we'll ever know. It's so complex. Like, how do you do a study on these 3 medications being taken? The combinations it's probably in the billions of combinations. Right. And I would say that maybe 3 meds taken at this time versus 3 meds taken at this time, or 4 at this time, there's going to be different interactions. I don't know. The only way to figure that out is just take less medications and you don't have to worry about drug interactions. And that's the reality of it.
Yeah, there are studies in general. If you have two drugs that are competing for the same enzyme system, cytochrome 450, for example, the chances are the likelihood is it can increase the amount of time that it keeps one of those drugs elevated versus the other. And so that common sense would be that it could exacerbate the potential ability to function, right? Cognitive skills or whatnot. So that information is out there. But
Right. No, I'm not saying that we don't know anything about pharmacokinetics or pharmacology. I'm not saying that. I'm just saying once you get a patient who's on 13 to 15 different medications, anybody who's going to tell me that they know what the drug interactions for all that is just completely lying to you. Plain and simple.
I don't mean that. I think it's just more of a general approach of, I guess where I was curious is that certainly not your responsibility to tell them you can't go to work or drive. But are you taught that, or is that encouraged to educate them as the potential of how it can impair driving or their work responsibilities, especially, let's say they're getting ready to fly a plane.
Yeah, there's rules on being a pilot and what medications you can take, even medications like Sudafed. There's rules on what you can take prior to flying. Are we trained in that? Yes. Do we know it fully? No. Do we rely on our EMR systems to help give us warnings when you try to prescribe something and something's already prescribed and it'll pop up and say, hey, listen, there's this drug interaction? Yeah, absolutely. We need that. And that's what technology is for. But if I prescribe you the antibiotic and you're on the birth control pill, I don't know if the antibiotic is going to affect your ability to get pregnant on that birth control pill. I'm sorry. I just don't know that. Unless there's going to be some AI thing that's going to pop up and tell me, hey, listen, by the way, you're more prone to get pregnant, even though you're on this birth control with this antibiotic. And I know there's medications that will make oral contraceptives less effective. What
Right.
exactly they all are, I have absolutely no clue. And I don't know if anybody really does absolutely know which ones and what dose and timing, if timing is related. But we prescribe these medications all the time.
Yeah, I took in on this. Yeah,
Please do.
I'm sorry to interrupt, but it's a great discussion. And just to piggyback on what Dr. Girgis says is when we're prescribing medications, we get a flag, right? Oh, a patient is on a live medication or a patient. When you have a patient on several medications, it is unavoidable. There are going to be interactions. And the timing of that, and to tell a patient, hey, you just because you're on all these medications, you can't do the functions of your life. No, but that's where patients need to have just an accountability of knowing what they're ingesting and what that may cause. So, just to reiterate, so many patients are on so many meds, it's inevitable to not have interactions. And I don't know any other industry that does things the way that we do, but I'm sure you can look up the statistics, and death from medical medications is one of the top rating deaths that we have in the US. I'm sorry, I can't quote that exact, but it's a lot to do with medication and medication interactions. And so if this was the automotive industry or the restaurant industry, there would be an accountability. There would be something pulled because of this life loss of limb stuff. But in our industry, no, we risk benefits, right? Most of the time, this algorithm is dictated to us. I personally might not want you to be on this medication. I do see the risk, but our system tells us go ahead, give this medication, and there are no safeguards for the patients if they do encounter an interaction. You can't go to the pharmaceutical and say, hey, I had an interaction. There's no accountability on that side of things. And it always falls on the provider, hence our concern, because it's a lot of weight to carry and to know I'm in trouble if I don't order you this med based on the healthcare system. Your health is at risk if you don't have this medication. And it's just unavoidable with the status of our health. That's why primary and root cause is so important.
Agreed. And I certainly would never expect physicians, psychiatrists, or nurse practitioners to know all the what a flow chart. You're focusing on stabilizing and getting them healthier.
We know pretty well. I will say we know them pretty well.
This is why it's such a great opportunity for that collaboration with having a pharmacist and a toxicologist or herbs involved, bringing an herbologist.
And
This is where they can come in and say, if you put these two drugs together, And there's just certain things that can cause issues with liver, with the kidneys, with breaking down things to a more simple form. You're not expected, and I hope it didn't come across that way, for you to know everything. That this is the point I'm trying to make is we don't all know everything. Why would we not want to have a collaborative healthcare model to bridge that gap in knowledge so that people can share that knowledge and address these very things in real time? Phone a friend. Hey, got this going on. What do you think? I'm not saying that's how you do it, but I'm just throwing that out as an example. Ariel, did you want to bring something up?
I was just going to say, too, the other side of it is whether or not the patient is disclosing. While our EMR systems have gotten better, there could be medications they were recently prescribed that we don't know about. So that adds to the complexity of this. And they usually don't share supplements, right? So our screening tools are usually to go over medications, but they don't go over all of the supplements that they're taking. And if you ask somebody, hey, are you taking anything? They think medication. But frequently they'll forget medications that are in the fridge, medications that are on the countertop or next to the sink that they only take in the morning or only take at night before they go to bed. They forget the creams and the ointments that they take, which all add up, plus the supplements. And going back to, I think, something Evan said earlier, which was sometimes providers don't know enough about supplements. So then they shut that conversation down. And when they shut that conversation down, the patient is less likely to share that information. And we have actually seen poor outcomes as a result of that, like patients going to surgery that are on blood thinning supplements. And then they go into surgery and they have the potential to bleed out in surgery because there wasn't enough faith in the practitioner to share that they were taking 3 grams of fish oil a day and ginger root and ginkgo biloba and garlic and all these things that had that potential. And it's all additive. It's not right. It all adds to that same problem because they all work in different pathways of that. So with all that said, it's nearly impossible to know everything that a patient is taking without physically going to their house. And even with that, I used to do in-home patient visits. You'd have to search their whole house, every nook and cranny, to see that as needed Advil that they're taking on top of their Coumadin that they don't tell you about because they think it's Tylenol, right, instead. And that's what they should be taking if they're having pain. But they don't know enough about medications to really know that. So it's very challenging. It's incredibly challenging. And I think we do try our best, right? I would believe that every single provider who prescribes Ambien is telling a patient to take it at night. I think everyone who would prescribe an opiate would tell their patient this could make you drowsy, right? I don't think that they're sidestepping any of the requirements for prescribing or advising them on some of the problems. What it comes down to is personal responsibility, which is what Dr. Gerges was saying earlier, on the individual to take accountability for what it is that they're taking, the things they were advised. And while I know that they could be on, he was being very kind when he said 15 medications. I've seen patients on 40 medications, which seems ridiculous, but it happens. And so it's hard for them too. So they almost need their own personal pharmacists to navigate through life at that point in time. It's very complicated, incredibly complicated. We just all try our best.
I don't doubt that. And I'm not trying to imply that. I do have some experience with all of that. I have seen the other side of it with a family member, a neurologist, who said, it's okay for this person to take pregabalin and this whole 4 or 5 and drive. They'll be fine. It won't affect their mental or cognitive capabilities. I'm thinking, you're a neurologist and you're telling this person. I was in the room.
Oh,
And
I've had
and a
cardiologists say,
neurologist. And
or if 5 blood pressure meds aren't making you dizzy when you take them all at the same time. I mean, yes, I agree. Yeah, they should know. They should be advising better.
but I'm certainly not trying to generalize either, because it's just like any walk of life, any field. You're going to have people that are more knowledgeable than others, people that take the extra time to educate, and then the actual standards might be different. That all together. Evan, given your background with both research and patient care, what do you think is the biggest barrier to integrating complementary therapies like ozone or UVBI into mainstream healthcare?
Funding is my short answer, and perhaps that was your guess too, but we really don't allocate funds well, not to research. Where the funds come from is a problem because when you're contributing such large amounts, you have a bigger say in dictating what's being researched. And so I'm not thrilled about the lack of research we have in compared to other countries for the integrative modalities, specifically ozone and UVBI. My suspicion is because they're very efficacious and they reduce long-term prescriptions. That's one possible reason why. But in short, the issue definitely surrounds where our funding is going. And so you got to ask, why are we limiting research? Why don't we want to get better answers? So that's what I would respond with. Yeah.
Knows, maybe that's about to shift.
It looks like that, which is so exciting. And as in anything, we really need citizens, right? People to that's good enough to petition to really put their voice out there and speak what they want until we start to see those answers.
Totally agree. We're going to move into the roundtable and
I was just going to add something really quick, and
Yes.
that is that I think going back to Evan's original comment, I think patients should start asking more of the but why.
Yes, agreed. Again, that's the freedom of making the choice for your own health, taking that ownership, being empowered. Dr. Yergis, how do you think healthcare professionals can work together across different specialties such as integrative medicine, emergency care, nursing, alternative care, psychotherapy, for example, to improve the overall patient experience and outcomes? So the best of both worlds. Let's say you're in the ER and you had the time, you weren't being rushed through. What would be your wish list?
Yeah, I mean, for me, it's a little different because in the emergency department, we're not really dealing with kind of chronic care. We're dealing with kind of the acute problems on top of their chronic issues. I think the model has to change. Most healthcare systems, when a family of four is paying $2,000 a month to their healthcare system to see their doctors and their in-network physicians, how do you go see a holistic physician, or how do you see a chiropractor, or how do you see maybe a psychiatrist or a therapist that's outside of your network, or any of the other kind of specialties that are not considered allopathic medicine? The only way to really do it is to pay out of pocket. And I don't know, after spending $2,000 to $3,000 a month on your family insurance plan, if people have the money to do that. So I think the system has to change. It's just going to be time will tell unless the patient themselves are actually actively looking for other modalities. And I don't know if a lot of folks in Western medicine are aware of all the different other modalities other than maybe like chiropractic. I've never heard of Ayurveda until we've met.
Yeah.
Absolutely no clue what it is. Am I open to it? I don't know. Maybe. I have no clue what it is other than just very minimal. I also work in a different world where I'm not primary care. I'm not seeing people who just have kind of chronic disease. I'm seeing the person with the diabetic foot ulcer that may or may not need to be admitted because they're septic from the infection, and they're either going to get better or they're going to end up having a limb chopped off. And at that point, probably not appropriate to say, oh, by the way, there's a good chiropractor that's going to help realign your spine and may make your headaches feel better. So I don't have that I don't have that ability to even talk about that, but I know there's there's Eastern medicine been around much longer than Western medicine. And I'm sure there's some validity to it. What it is, I don't know specifically. And I would let patients know, go check it out. I don't think everything other than Western medicine is voodoo or nonsense. There's going to be obviously something to it. I'm just not well versed on it.
And I'm sure there are many that aren't. And I've spoken to a lot of Western medicine doctors, and they're like, I didn't even know what it was. I had no idea. And I started doing transcendental meditation. And my transcendental meditation instructor said, with what you're trying to do with helping people heal, you need to go look at this Ayurvedic program. I was like, what? What is that? And so I got into the program because the tuition was fairly inexpensive, and it changed my life. It is absolutely amazing. I've seen people turn their life around, chronic illnesses. I'm one of them, but I don't know if I accidentally did it or if it was just being tuned into my body, but I got rid of 6 chronic illnesses after 25 years, diabetes being one of them. I was just teetering over into the diabetes A1C levels and the glucose. But because I made significant changes in my life, diet, routine, exercise, meditation, locked it down. There's so many other people that I've met through Ayurveda that have done the same or have helped people do that. But there's still some limitations in that area. There's still some limitations with psychotherapy that Western medicine brings to the table. And that's why I think that trifecta approach is so awesome. And if you're ever curious, I can absolutely send some basic information and a link. Dr. Garius, I'm happy to share with you. Who knows? You might have someone come through the ER where there is a digestive issue. And you're like, you know what? I don't know anything about this, but it's been around. Obviously, it worked for some people. I'm just check it out kind of thing. You never know. And that could prevent them from waiting months to see their primary care. Just throwing that out there as an idea. There's a lot of talk about the importance of addressing root causes or illnesses rather than just treating the symptoms like we've talked about today. How can we shift the focus in healthcare system to prioritize preventative care and root cause management? Raise your hand if you want to answer that. Evan, Ariel, Evan. All right, all you.
I initially have several ideas when you ask that question, but I'm going to choose an interesting route on this one. I think it's the way in which we chart, our charting. So, charting currently, if you didn't chart it, it didn't happen. But the way we are charting right now is primarily to cover our behinds. That way, when you're audited, all the key things are hit. I think if we can have, again, more time to really draft our charts so that this can be a tool holistically, so that while we're treating the patient, we can not only understand from the other provider's perspective what they see as the root cause issue, but also what they've done, and how my treatment might interact with their treatment. And that way, even the patient can influence this information and data and input from their perspective and their ideas. So I think the charting is going to be something that we could see a change in. It's not drop downs. It's not, oh, I completed this bundle of stuff so that I get paid by my insurance and I'm not by my charge nurse telling me you forgot to do this thing. It's really patient focused, not data, not insurance to satisfy the CMS, but really to address the patient and have a comprehensive understanding of their needs.
Thank you very much. I'm going to go back to Dr. Girgis really quick. Telemedicine has expanded greatly, especially post-COVID, but you've all highlighted that with some diagnoses, it still requires, obviously, in person. If you have to do a physical examination of a person, for example, obviously ER, you have to go in person. How do we balance the convenience of telemedicine with the necessity of face-to-face medical evaluations?
Yeah, I mean, it's going to be provider specific. So I have the ability to do some telemedicine services, and I think in general it's great, but there's specific things it's great for. When you call about the UTI symptoms in a female who's had them before and has previous labs to indicate maybe a previous urine culture, and I can basically send another repeat urine culture, basically empirically treat if that's what they want. Some people don't. They want to just make sure it is or not, and then get the antibiotics later. So we have the ability to do that. And that works great. Imagine the time it saves you from leaving work, going to the doctor, sitting for 30 minutes, to see the doctor for 10 minutes, to have a urine dip done, to go. That takes hours upon hours versus now it's a quick 10-minute call. Maybe you have to go to the lab, drop a sample, pick up the prescription, wait for the results, or just start taking the antibiotics. And that's a very simple thing. But when you call with your chest pain, your belly pain, your ear pain, those are just some things that we just can't do over telemedicine. And most patients are pretty equipped to take that. Listen, you're going to have to probably go get seen face to face for this. Otherwise, I'm just completely guessing. And I'm not one of the physicians that will write an antibiotic for an ear infection that I can't look at. That's just something that I know it's inconvenient, but you need to go in now, take responsibility and have your ears looked at. It could be earwax. It could be an outer ear infection. It could be an inner ear infection. It could be a perforated eardrum. I have absolutely no clue. And each one has a different treatment, a different oral maybe versus otic antibiotic or even maybe just a basic cerumen disimpaction and you're better. So I think patients with time are going to start to understand the convenience of telemedicine, but then there's some patients who just don't have a clue and they get upset with you when you tell them, like, you need to go in and get seen for this. This is not something I can do over the phone. I think it's great. It's not a one size fit all for everybody. Some physicians will treat flu like symptoms with Tamiflu. I'm not a big fan of that unless you actually have really good evidence. Like I was in a room with three other people that all tested influenza A positive, and then I have no problem doing it. But when you call me and say, oh, some kid at school had influenza, now my kid is sick for 6 hours. Can I get Tamiflu for my 2-year-old? I'm not a fan of that. You should go get swabbed. We're still within a treatment window. If you decide that you want Tamiflu for your child, then we can prescribe it once we have data that says your child has influenza and not just one of the other 200 common cold viruses. Yeah, it is very convenient. I think it is the way to go. I think it's the way for a lot of people to get primary care type things without having to go be in the doctor. That being said, hopefully we can save time. If you just need to have your lipid check, your electrolyte panel check, whatever checked every year, minus you're not going to get your lungs and heart listened to by your doctor. But if that opens up a time slot for someone who is now got influenza or sore throat or needs to be swabbed, may need penicillin for strep throat, then it gives them that ability to actually go see their physician face to face. But I think a lot of people are just going to start to say, listen, I've had a cough, I need antibiotics, and that's what they call telemedicine. We'll see. We'll see how it's booming ever since kind of COVID. And I
Yeah.
don't, and it is great, but it's not great because I think a lot of people with this whole patient satisfaction thing basically just give in to the patients. I want this, I want that. Then they call back 2 weeks later how they have diarrhea from their antibiotics for their virus infection that they demanded they wanted antibiotics for. And you got to just be like, told you so. What did you want? So
As in, that's got to be very challenging to balance that. You're trying to do the right thing ethically and make the patient happy. And sometimes what the patient's requesting is not necessarily what's best for them. And you have the knowledge. And when you're doing telemedicine, you can't see everything, right? Seeing is believing. You're limited to this video versus it's like the Grand Canyon. Looking at the picture of the Grand Canyon or even a video does not do it justice. When you're there, you have all of your senses taking that in, hearing, seeing, smelling, feeling. And when you're in the presence of a patient, same thing, right? It is better, but depends. And also with a distance monitoring type of technology now with blood pressure cuffs and Fitbit's technology, that actually could make it possible to give you more readback information depending on the platform, I would imagine.
yeah, there's a lot of technology. They have now video assisted otoscopes. Oh yeah. Do you spend $300 on that? Then have it integrate. Who's going to spend $300 on that versus just going in to get, and then if you have it, is it going to integrate with your provider's telemedicine service? So it's great in theory. I've actually treated otitis media over the phone because the child's mother was a physician and just
Oh,
wasn't a physician in the group. And
right.
I have to go on their word. But basically document it well. And her father, who said the tympanic membrane looked erythematous and bulging, you just treat based on that. And maybe you can save them some time there, but that's one in a thousand. So it's not very common, but it's an advancement. It needs to get better. And I think patients need to understand limitations.
Yeah. Thank you for sharing and especially your perspective. And you're in a little bit of a different setting versus some of the other providers too. So, Ariel, what would be an ideal collaborative model for healthcare? What would it look like in practice? So, there's two questions here. The second question is how can we break down silos in healthcare to create a more patient centered, outcome focused system?
I would say in order to help encourage a collaborative model, which is ideal for patients, right? Because the right hand needs to know what the left hand is doing at all times. If we're looking at minimizing medication errors, like we brought up earlier, or overprescribing, right? So if I don't know what one side is doing because we don't have note sharing capability in our EMR systems, or I haven't had an opportunity to have a direct conversation, there are lots of healthcare providers out there right? Especially if you're in a really metropolis area, there's going to be people you've never seen, you've never heard of. They're new to the community, they're new to the environment. You've never had a conversation with them. So it makes it very challenging. By bringing that in, though, by bringing in a collaboration, a collaborative model, I think we really can accomplish great things with a patient. Meaning, if I'm approaching their concerns from multiple different aspects, we can say, okay, you're thinking I should be doing this, and I'm thinking I should do it this way with the patient. What if there was a middle ground? What if there was something that we could do that met both concerns in one medication, one supplement, one procedure, whatever the case might be, right? And we do see that in some cases where we'll have collaboration. I would say the example that I can give would be oftentimes now with cancer treatments, right? If they're going in to do surgery, they'll bring in multiple surgical specialists, right? Maybe like plastic surgery with an oncologist, right? Or they might bring in a gastroenterologist with the oncologist, right? And so they'll both perform surgery together. And I think it has created better outcomes for those patients because there's fewer post-op complications. They're approaching it from their different subspecialties. And so they're catching things that maybe the other side wouldn't have caught to begin with, right? And so it creates better outcomes. If we're looking at it in general outpatient practice, same thing, right? The hope is that we're creating better patient experience, better patient outcomes. We're reducing that risk for things like polypharmacy, like we mentioned. Even we can get into like poly supplements, right? I've seen patients who will take individual herbs and supplements for each individual thing, and they end up taking like 50 supplements a day. And you're like, why are you taking all this? All you're eating is supplements. Like, it's not necessary. You should probably just eat really good food. Have a few key things that might be just beneficial, right? So I think that's where collaboration can come into play and benefit us as a whole. Um, in practice, ideally, being able to have open conversations, whether it's through the EMR itself, whether it's through electronic communication that's HIPAA protected in some way, shape, or form. And then in order to break down these silos to help with that, I think we just have to be open. We have to be open to the idea that everyone has their area of expertise and we can all benefit from talking and having conversations with each other and learning something. I'm not trying to take your job as the dermatologist. I'm not trying to take your job as the oncologist. I do my own thing. But if I have a little bit more information, maybe the next time I see a patient with a similar concern, I'll have some background on how to get the ball rolling a little bit better.
So it sounds like that's all Western medicine. What about psychotherapy? What about
All of it applies together, I think. I don't think it's just Western medicine. If I had a chiropractor who said that this patient got stuck under a car, so they went in and saw Dr. Gargis when they went through the ER, right? And then a chiropractor was helping them with their rehab while they were going to PT after they'd done surgery. And Evan's over there giving them ozone treatment. And I'm over here providing integrative medicine to help with gut repair after their digestive system got blasted by antibiotics after their surgery. It's all the same patient. I still need to collaborate with everyone in the care team, no matter what option they're providing. I need to know what the acupuncturist is doing. I need to know what the Ayurvedic practitioner is doing, the psychotherapist. We're all in it together to heal the same person.
I'm going to go around the room, this virtual room, and any last statement or comment you want to make? And also, if you want to share anything about your business and how people can contact you. We'll start with you, Dr. Girgis.
It's just a pleasure, being on the chat with you guys. I just think patients are going to have to start taking their medical care, their health kind of into their own hands. They're going to have to do their own research in this day and age of internet and social media. There's information all over the place. Just got to do your research. You got to be able to ask uh, the right questions. And if you're not getting the answers that seem kosher enough to you, then look other places to make yourself healthy. I would advise most folks that, and I think we beat this into the ground: diet, what you put in your mouth, your environment, what's surrounding you in terms of toxins and chemicals that you put into your body or put onto your body are all going to affect your health. And if you've got children, be worried what you put into their body and on their body, be it from food to chemicals to lotions to sunscreens to anything that touches them. I would be just be cognizant. There's some optimism that things are going to change for the right for all of us in this country. We'll see. I think that sums it up for me. And I will say, I mean, there obviously is in Western medicine a role in it. I don't think Western medicine is all bad. I just don't think we've got the answers in Western medicine for everything. Acute care, we're really good at it. You broke something, we'll fix it. Something burst in your gut, your appendix burst, we'll fix it. You having a heart attack or a stroke, no problem. We can try to fix it and we can limit the damage that's going to occur. You've got a pneumonia or traumatic injury. We can treat it. We can fix it. Chronic stuff, I don't think we're that great at it. But then again, we're also limited to what we get. If you're 400 pounds walking into us and you decide that you want to eat McDonald's all day and you feed McDonald's to your 5-year-old and they weigh 100 pounds, we can't blame Western medicine also for that. Everybody's going to have to take some responsibility.
Agreed. Did you want to share your contact information?
Yeah, I'm on LinkedIn, Michael Gerges, MD. My business is outside the realm of this in terms of executive protection, protective medicine, working with paramedics, private family offices for protection. But yeah, I think LinkedIn, you can find anything about me.
Thank you. And thank you for being here today. I really appreciate you sharing your knowledge. And we will share his bio because we didn't get into all of the details. He's pretty fascinating and impressive background. Ariel.
Just thanks for having me on the podcast today. I really appreciate it. I'd love to share information, knowledge, education, and really help for the betterment of society and health in general. I agree with Dr. Gerges that it's everyone's personal responsibility, and we are starting to see that pick up. I do work in primary care offices sometimes as well, and I see that. I see the desire from patients to want to do better, to want to learn more, to have that drive. So I think it's really positive. And I'm going to stay as positive as I possibly can about that because the hope is that we can make some good changes for overall health. I can be found on the Connect for Healing website, so you can book through there. I also have my own business, Activate Telemed, as well at activatetelemed.com. You can find information on both sides. And I'll pass it to Ed.
Thank you so much for being here. We're going to share all of her bio as well and links as well. Evan?
Yeah. So I echo the sentiments here, of course. It has been a pleasure to be a part of this conversation. A lot of knowledge, and I'm happy to learn from you guys as I'm also discussing these topics. And I think one of the things, of course, accountability is the thing we all, as providers and patients and in your individual health, have an accountability to seek out that knowledge and ask why and question the narrative. And I'm not saying all narratives are wrong, and I don't think you need to take it with this tone of skepticism, but just keep discovering what's true and what's true for you as an individual. And your health really is your wealth. Think about how you want to spend your sunset years and what your behaviors now are going to influence that. Do you want to be in the bed with bed sores, or do you want to be active with your life? I'm also on the Connect for Healing platform, so you can find me there. And I do all of my infusions at the Advanced Wellness Center, which is in Westminster in California. So I'm sure we can link some stuff there, but I just want to thank you again and encourage everyone. I know this was a lot of stuff, but bring it into the basics. It's easier than it sounds, and the hardest part is starting.
It really is. And I'm so grateful that all of you are here. I know you guys are really busy. Everyone here has like multiple jobs. So commonality we all have, passion projects, so to speak. And thank you. I'm really grateful. And again, you can find the platform at connectforhealing.com. Both Ariel and Evan are listed on there. Dr. Michael Gerges has an extremely busy life, and to even fit that in, I'm so grateful. And I do recommend you check out his LinkedIn. I might have to edit this out, but he's a badass. I don't know if I can say that. It might have to be like, you have to be the age of 13 or 16 to be able to watch this by saying that. But anyway, I'll edit it out. I'll be like, anyway, you all are badasses too. Thank you. And I'm really grateful. And it's a wrap. That wraps up today's discussion on episode 9. A huge thank you to our guests, Evan Toomey, Ariel Kazi, and Dr. Michael Gierkes, for sharing their expertise and insights. It's clear that there's no one-size-fits-all solution for fixing the healthcare system. But the common thread in our conversation today is that collaboration, innovation, root cause analysis, and a focus on the whole person are key to creating meaningful change. We've only scratched the surface of what needs to be done. But if there's one thing we can take away from today's episode, is the future of healthcare doesn't have to look like the past. There are real opportunities for improvement, and it starts with all of us, patients, providers, and policymakers, working together towards a more inclusive, holistic, and effective system. Thank you for listening to Your Health is Wealth podcast. If you've enjoyed this episode, be sure to subscribe, share, and leave us a review. We'll be back with our next episode with more thought-provoking conversations. Until then, take care of yourselves and each other. We are interested in feedback on our episodes and learning what topics you may be interested in for future episodes. Please follow us on Instagram, Your Health is Wealth Podcast. Also, our website, yourhealthiswealth.com, and is spelled with a Z instead of an S, for yourhealthiswealth.com. The link to the website is also found on the Instagram bio as well. On our website, we list the episodes, and there is an online form where you can fill it out, share your feedback, ask questions, share input on future topics, and also contact us if you're interested in being featured on the podcast. Topic scope is related to health and wellness. Thank you very much for listening to our podcast today and look forward to more. Have a great day, everybody. Take care.